So I'm Sarah Rickard. I was formerly the Medicines for Children Research Network Manager, and I'm currently the Interim Research Delivery Manager for Division 3. I think you're interviewing tomorrow for 2 new divisional managers for 3 and 6, so I'm very much keeping the seat warm for the next person. So, in terms of the division, what does it look like? Well, we have 4 specialty groups within the division. We are led by Ed Johnson, who is a senior lecturer at the University of Manchester and also an obstetrician at St Mary's Hospital. We have got children's, which is being led by Dr Claire Murray, who is a senior lecturer also at the University of Manchester and is a consultant paediatrician in respiratory medicine at Royal Manchester Children's Hospital. We've got genetics, which is being led by Professor Bill Newman, and he's also, I'm going to be repetitive here, he's a University of Manchester chair in translational genomic medicine and also based at St Mary's Hospital. We've got non-malignant haematology, which for those of you who aren't familiar with such things, it's the non-cancer bits, so it's the sickle cells and the blood disorders as opposed to the tumour side of things. And that's being led by Dr Charles Hay, who is a consultant haematologist at the Manchester Royal Infirmary and also an honorary lecturer at the University of Manchester. And finally, we have got reproductive health and childbirth. That's being led by not a doctor, but by Cathy Melvin, who is a senior midwife at East Lancashire Hospitals. So someone from outside of the traditional Greater Manchester region, and very much welcome as part of the new geography. I've been squinting earlier to see if I could see any of these people if they're here, but I'm hoping I've seen a few people. A few people are waving. I can see Cathy. Excellent. So hopefully I'll bump into you all a bit later. There's a bit of a theme with our slides. We might have shared them before we put them together. So you'll be familiar with this particular concept. So thankfully, Zoe's already explained what it means. But you'll see that Greater Manchester, for those of you at the front you can't quite see, we're placed kind of 4th from right, which means that we are 4th highest in terms of numbers of studies, and we're actually 8th highest in terms of total recruitment. So again, punching above weight or there or thereabouts in terms of the national perspective. Another familiar slide. So we have a number of the specialty groups that are, we have one that's doing extremely well at the top there, which is reproductive health. We have genetics, which is sitting just at the top of the amber grouping. They've been RAG rated according to where they sit. So the red ones are the top 5 of the local clinical research networks that are involved. The amber in the middle, and then the red, which is the naughty step, are rated as those that are being in the bottom sort of 5 of the national perspective. So you can see that children sits on the naughty step along with haematology. I would say, being the MCRN ex-manager, that children is renowned in this part of the world for doing lots of commercial, highly complex, very low number studies. I've just started working in primary care and cannot believe how big the studies are when our usual study number or recruitment target in children's is 2. So to be casually told of a study that's got 4,000 patients almost sends me into cardiac arrest. So it's a different world, shall we say. So enough of my justifications. In terms of staffing and what the network helps to fund, what we've got in the 2 different areas is actually quite a CMFT-focused staff group, and that's primarily because the children's and certainly genetics, the tertiary centres are based at both St Mary's and Royal Manchester Children's Hospital, so it's not surprising that the biggest grouping of people would be there. We've also got the reproductive health and childbirth. The academic centre is at St Mary's Hospital as well, so it's not a great surprise that the biggest numbers of staff would be in and around central Manchester. So in terms of what we've got a group of core staff who are based, who used to be the Medicines for Children Research Network, who work as part of the children's specialty group, which brings together the medicines and non-medicines portfolios. They're based at the Children's Hospital and outreach across the network. We've got a genetics team based at St Mary's. We've got a research nurse based for haematology, and we've also got a team based in reproductive health and childbirth that are based at St Mary's. But in addition to that, we've got staff based at Wigan and East Lancashire that are involved in children's and also reproductive health and childbirth. So there's a mixture of sort of nursing staff there. And then also at East Cheshire, Stepping Hill, Pennine and Tameside, there are staff supporting children's research. So there's a mixed staffing across the patch, covering the different elements of the portfolio. And we'll be looking to find ways of working within the division and also across the division to maximise the staff that we've got, to make sure that every nook and cranny of the portfolio is supported as best as it can be. So just finally, again, another slightly familiar slide. We like to get you used to these things. So this is just really the response to the high-level objectives. So these aren't the high-level objectives nationally that each have been set, because as Zoe and Sue have alluded to, there were quite a lot of them. So this is really our response locally to how we're going to help meet some of those national objectives. So for children, it's about expanding the industry portfolio. It's already big at about 50%, but it's about making sure that that continues to grow, and also to continue to develop the capacity through principal investigators and chief investigators. For genetics, it's developing and expanding the portfolio. It's grown quite considerably in the last few years, but it's about making sure that we're doing more interventional studies as well. Non-malignant haematology, quite small at the moment, quite an industry-focused portfolio, but it's about making sure that also grows and the capacity is developed. And reproductive health and childbirth, it's about developing, again, more industry work, which will be music to Martin's ears, but also increasing the number of partner organisations that are recruiting, because it might not have escaped your notice, but babies are born in quite a number of the hospitals that we have in our patch. So we want to provide access across all of those different areas. So I don't think I've thought of any cunning words to sum up, but it's going to be an exciting world for the new manager to take over and working with the new specialty leads and the divisional lead.